Health insurance in United States. Health insurance in the United States is any program that helps pay for medical expenses, whether through privately purchased insurance, social insurance, or a social welfare program funded by the government. Synonyms for this usually include health coverage, healthcare coverage, and health benefits. In a more technical sense, the term health insurance is used to describe any form of insurance providing protection against the costs of medical services. This usage includes both private insurance programs and social insurance programs such as Medicare, which pools resources and spreads the financial risk associated with major medical expenses across the entire population to protect everyone, as well as social welfare programs like Medicaid and the Children's Health Insurance Program, which both provide assistance to people who cannot afford health coverage. In addition to medical expenses insurance, health insurance may also refer to insurance covering disability or long term nursing or custodial care needs. Different health insurance provide different levels of financial protection, and the scope of coverage can vary widely. More than 40% of insured individuals reporting that their plan do not adequately meet their need as of 2007. The share of Americans without health insurance has been cut in half since 2013. Many of the reforms instituted by the Affordable Care Act of 2010 were designed to extend health care coverage to those without it. However, high cost growth continues unabated. National health expenditures are projected to grow 4.7% person person per year from 2016 to 2025. Public healthcare spending was 29% of federal mandated spending in 1990 and 35% of it in 2000. It is also projected to be roughly half in 2025. There are other types of insurance we will read about: enrollment and the uninsured. Gallup issued a report in July 2014 stating that the uninsured rates for adults 18 and over declined from 18% in 2013 to 13.4% by in 2014, largely because there were new coverage options and market reforms under the Affordable Care Act. And Rand Corporation had similar findings. Trends in private coverage: the proportion of non-elderly individuals with employer sponsored cover fell from 66% in 2000 to 56% in 2010, then stabilized following the passage of the Affordable Care Act. Employees who work part-time less than 30 hours a week were less likely to be offered coverage by their employer than were employees who worked full time, 21% versus 72%. A major trend in employer sponsored coverage has been increasing premium deductibles and co-payment for medical services, and increasing the cost of using out of network health providers rather than network providers. Trends in public coverage: public insurance cover increased from 2000 to 2010, in part because an aging population and an economic downturn in the latter part of the decade. Funding for Medicaid and CHIP expanded significantly under the 2010 health reform bill. The proportion of individuals covered by Medicaid increased from 10.5% in 2000 to 14.5% in 2010 and 20% in 2015. The proportion covered by Medicare increased from 13.5% in 2000 to 15.9% in 2010, then decreased to 14% in 2015. Death. Since people who lack health insurance are unable to obtain timely Medicare, they have a 40% higher risk of death in any given year than those with health insurance, according to a study published in the American Journal of Public Health. The study estimated that in 2005 in the United States there were 45,000 deaths associated with lack of health insurance. 2008 systematic review found consistent evidence that health insurance increased utilization of services and improved health. Those who are insured may be undersized, such as they cannot afford full medical, for example, due to consumption of pre-Soldian. And the last we have left with this topic. So hope you guys enjoyed the video. If you did, don't forget to share the video and subscribe. Bye bye.